Hi, I'm Dr. P. Vijay Karan Reddy. I'm a consultant radiation oncologist working at Apollo Cancer Hospital. And I will talk to you a little bit about head and neck cancers today because head and neck cancer is also one of my areas of interest and my specialty. So head and neck cancers are very, very common in India, especially in India compared to the Western world. They are the second most common cancer in India. We see about at least a lakh to lakh and a half cases every year, and about 40 to 50% of them end up not getting cured. So these are very, very significant numbers, and it shows the importance of knowing a little bit about head and neck cancers in India. So first, we'll start off with the most common causes of head and neck cancers. First of all, I'll talk to you about what head and neck cancer means. So all the cancers of the face, of the head, and the neck region are known as head and neck cancers. So cancer is formed in any part of the body, as we all know. So in head and neck, the organs or the parts that we are concerned with, first and foremost, the nasopharynx, that is the area behind the nose. Second thing is the oral cavity, that is your tongue and the cheek, the area inside the cheek. Third is the oropharynx, which is the area behind the tongue, behind the mouth. Then there is pharynx, which is your food, uh, the area where you take in the food. Then there is larynx, which is a voice box, which is responsible for your voice. And as you go lower down the pharynx and larynx, then you encounter the esophagus, which is the food pipe, but that does not come under head and neck cancers. So coming to the causative factors, as you can understand by now by the term of head and neck cancers, that everything related to the face and the neck is head and neck. So the causative factors also, as you can imagine, the most common and causative factor and the factor responsible for about 70 to 80% of head and neck cancers is tobacco. Tobacco can be in the form of cigarette, that is smoking, or non-smoking, chewing tobacco, using snuff. Anything can be a risk factor for head and neck cancers. Tobacco, apart from the smoking tobacco, the second-hand smoke that you inhale also can cause head and neck cancers. Usually, the smoked tobacco causes the pharynx and laryngeal cancers more commonly, and the chewing tobacco causes the oral cavity cancers. Apart from tobacco, there are other causative factors also, like alcohol, especially when you mix alcohol with smoking, both together become even more a potent mixture and increases the risk of causing oral head and neck cancers to you. The next comes the virus, that is human papilloma virus. This virus has been found to cause mainly oropharyngeal and oropharynx cancer. However, the incidence of this virus in India is comparatively less. Only 40 to 50% of the oral cavity and the oropharyngeal cancers that we see are HPV positive in India, whereas in the Western population, more than 70%, 80% are all HPV positive. The good thing about being HPV concerned cancer is that if it is HPV positive, first of all, the patients do very well. They have a high cure rate and a high chance of complete resolution of the disease. The second part of it is this enables us to use it as a preventive measure also. So if you take a vaccine as a male or a female, if you take a vaccine of HPV against HPV virus, the chance of you getting an oral cavity or oropharyngeal cancer with HPV is reduced by more than 90%. So this gives us a chance of prevention. The other type of virus is called Epstein-Barr virus. You must have not heard of this word many times. This is the virus that causes what you call as a mononucleosis, the infection mononucleosis, like a something like a flu, and this it plays a role in development of nasopharyngeal cancers. But one of the most common causative factor for nasopharyngeal cancer is Epstein-Barr virus, or we call the EBV. So we heard of HPV. The next is EBV. If you want to look at a little more less important but present risk factors, other things that you can look at is usually head and neck cancers are more common in men and women. It is usually seen in people who are 40 years and over. When you have a poor oral or a dental hygiene, you don't take care of your mouth well enough or your teeth well enough. That can also, with repeated infections, eventually lead to cancer. Environmental factors, like if people working in factories, they're ingesting chemicals, paint fumes, wood dust, asbestos, whatever it is, they can also cause cancer. Pure nutrition, vitamin deficiency, that is vitamin A, B, and C deficiency, can cause vitamin deficiency ulcers in the mouth, and repeated ulcers, non-healing ulcers, can eventually over a period of time turn into cancer. Apart from all this, in general, having a weakened immune system will definitely increase your risk, because your body is not able to fight against the potential infection or a potential uh, cancer forming. Now, after covering all the risk factors, we'll move on to the preventive measures that you can do. So you know what causes cancer. The best way to prevent it is you avoid all those factors. So stop smoking, whether it is chewing tobacco or smoking tobacco. Stay away from tobacco completely. Alcohol is still okay, but in moderation. Anything in excess is not good for you. So moderate alcohol, having about 100 to 120 ml per week is still okay. Make sure, now that I have told you about the HPV vaccination, EBV virus, and all so the vaccines against these viruses can be used to prevent oral cavity and oropharyngeal cancers. However, HPV virus vaccine is alone available in our country. Another common thing that you can take care of to prevent oral cavity cancers is that for people who have dentures, or people who have root caps or teeth caps that are present, you can you should be wary about how they're functioning, if they're fitting well or not, if there's a substrate infection. So keep going to your dentist for repeated screening and checkups. That also, we have seen many of the patients, because they have a denture, they don't see what is happening under them. They don't notice at the right time, so that becomes an issue. So now we've heard about what are the causative factors, how to, some of the steps that you can do to prevent it. Next, we'll move on to some of the symptoms that you can find in head and neck cancers. So I'll list out a few which are most common. First and foremost, a sore or an ulcer in your mouth that does not heal. So the first thing that you do is go to a dentist or a ENT surgeon when you have a sore throat, or a swelling or an ulcer in the mouth or your throat. So if this happens repeatedly, or the one that you have is not subsiding with any medication or slowly growing in size, make sure that you get it checked with an oncologist. A red or white patch in the mouth is very risky, in the sense these are precancerous lesions. They necessarily do not mean cancer, but even though they resolve, there's a potential, there is a chance that in the future that they might develop cancer from these lesions. If there is a lump or a mass in the neck that you notice, which is again growing in size, not subsided with antibiotics or medication, sore throat, persistent sore throat, like I already said, a foul mouth odor that is, you have good hygiene, but you're still getting a foul mouth odor. That also is one of the signs that you can look at. Hoarseness of voice, very common symptom that we see in voice cancers of the larynx, that is a voice box. Usually people think that it is a sore throat, or inflamed throat, inflamed voice cords. That's why you're getting a change in voice. Does not resolve with medication, then you definitely need to go see an oncologist. Uh, Coming to a little less common, frequent nosebleeds for nasopharyngeal cancers, nasal obstruction, or a frequent nosebleed is very critical feature. Because of nasopharyngeal cancers and involvement of few of the nerves that are in and around the area where cancers can form in the head and neck, you can have some difficulty in chewing, difficulty while moving your jaw. There can be weakness, there can be a headache, there can be excessive salivation or secretion. See, all these are some of the added features that you see. Don't think that just because you have a sore throat that you have cancer. What I'm trying to tell you is all these are common things that you keep going through day in and day out. Every other day, people have a cold or a sore throat or a headache or whatever it is. That does not always mean that it is cancer. It's only that for your information, you should know that it could be cancer if it is non-resolving issue, and you have to be wary and uh, show yourself to a specialist or an oncologist. So now that I have covered the basics, that we spoke about what head and neck cancers are, what are the common head and neck cancers, what are the causative factors for it, what are the preventive measures you can take about it, and what are the common symptoms that you can find in head and neck cancers. So the next, I will talk to you about the treatment. It is very difficult to cover all types of treatment, in one single go. So I'll divide it as much and make it simpler as much as I can. So the treatment depends on two things. One main thing is the site of the cancer. Second thing is, once you know the site of the cancer, where it's arising from, you have to make sure that you know the stage of the disease. So you have to evaluate the patient, make sure you know the stage of the disease. Depending on the site and the stage, we decide what type of treatment is required. In general, head and neck cancers have combination of three treatments. That is surgery, radiation, and chemotherapy. So most commonly, we use surgery in many of the sites in many of the stages. And as a curative treatment, radiation and chemotherapy are also used in mainly cancers of the throat, not higher up. Uh, but So I will try to explain to you site-wise. So if it is early stage oral cavity cancer, first and foremost, operate and remove the tumor. Depending on the size, if it is a little higher stage than 2, then you add radiation to it. Otherwise, surgery is the final and end treatment. When you go deeper inside, when you go to the oropharynx, that is a part behind the mouth, or when you go to the pharynx, or when you go to the larynx, originally the treatment for these parts was also surgery, but the surgery ended up being very morbid. That patient did not have a normal or a regular lifestyle post surgery, post treatment. So now in the new age era, we have found that giving this radiation and chemotherapy and avoiding surgery in areas of oropharynx, larynx, and hypopharynx, we found equal results. So we try to preserve the organ so that the patient can still have their voice and their swallowing intact. We try to avoid surgery and do radiation alone. Radiation is the primary treatment. The chemotherapy that we give along with radiation, IV drugs that is given once a week, that is basically to potentiate the effect of radiation and make it more effective and increase the chance of cure for a patient. So now we have done with surgery, we're done with radiation and chemotherapy. Next, we have something called immunotherapy and targeted therapy. These do not have any major indications in head and neck cancer specifically. We do use them, but usually in a recurrent setting where the patient has been treated but has a cancer again, and we feel that he cannot tolerate chemotherapy or radiation, then we think of giving him some targeted therapy or some oral tablets or even immunotherapy. But whatever all these treatments that we use, rarely used in a situation where we want to cure the disease, because I said recurrent disease, metastatic disease. In those situations where we're trying to prolong the life of the patient, we usually use targeted therapy and immunotherapy. So yes, so this is in general the entire overview of head and neck cancers that I thought I'll share with you. If there are any questions, you can feel free to reach out to me and ask me anytime. Thank you.